And we're ready to roll. Go for it. You gotta unmute yourself.
You would think I would know this by now, right? Thank you all for joining us. I know you're probably all spread across the country based on some of the names I see here, and I appreciate you joining us at whatever hour it might be. And to Gary in particular for inviting me. Let's see here. I am going to share my screen. Hopefully works for you all. All right, so I think everyone can see the slides now.
Perfect.
Thank you for the thumbs up there. And just to go through a few of our required slides, so to speak, and then we'll get into the meat of it. But today we're talking about mentoring, advising, coaching, and sponsoring. And if you are at all like me, sometimes I feel like I'm wearing all the hats at once, and sometimes I'm wearing just one, or I take one off to put on a different one. And so I hope you all will join me as we talk about this through the next hour or so. So there is CME credit. There was no disclosure required, but like most things in education, no disclosures to make here. And Gary and the ACE crew have put together these developmental series, 101, 201, and 301. 101 was done in the last year, and he is now on 201. And as you know, it's that second Thursday of the month at 1 p.m. Eastern time, and it's based on the guidebook for clerkship directors, fifth edition, which Gary and some colleagues co-edited. These were the lectures given in series 101, and they are available on the ACE website if you are interested. This is 201. So we are currently in May, and then next month, Michael Stein and Paul Hemmer are doing multiple clinical training sites. And then coming up in the next year, starting in September, you can see the topics that Gary has chosen, and I'm sure has already gotten some speakers lined up, but not yet updated the slide here for us. All right, so today we are talking specifically about chapter 25, which was advising and mentoring medical students. Hopefully in the sixth edition, if I am asked to co-write or write the chapter again, I would add coaching, advising, and mentoring medical students to the title. I think while we've probably always done coaching, it has become much more popular and common in the last few years, and definitely one of the many hats that we all wear. All right, so some objectives here. We will talk about what the different terms mean among mentor, coach, sponsor, and advisor. We will describe a few of the types of mentoring relationships and then analyze some situations in which each role or hat might be most appropriate, and explain some characteristics that make the mentee and mentor relationship most effective. And when I say mentor mentee, it's because I literally did not want to list out also coach, coachee, advisor, advisee, but sort of that pairing and what that relationship means for both you and your learner. And then we will illustrate some benefits to you as a faculty member for being an advisor, mentor, coach, or sponsor. All right. And I really want this to be as interactive as possible. So there are going to be some small group cases. I want you to feel free to raise your hand, ask questions, put things in the chat if Gary or someone can monitor it, since I'm not seeing that at the moment. But what comes to mind when you hear the term mentor? Feel free to unmute, throw it in the chat. A trusted guide, career advice. I was able to see that there. Thank you.
Also, the idea of this is what I did, here is a path for you to follow.
A little bit. Someone who's doing what you want to do. Okay, uses their experience. Great. All right. Yeah, I think you guys have some keywords here, in particular in that we have experience in a specific area that they may be interested in, and that we are providing both advice and guidance along that path. All right, how about coach? Helping someone improve a technique. Yep. Achieving a skill. Specific skill or behavior. Yes. Leading the students along what you taught them. Does not directly advise, but helps the person develop him or herself. Great. Helping achieve goals they have set. Excellent. Yeah, and I often think of the coach as not having to necessarily be an expert, right? You don't have to know exactly that field, but you need to know how to help the learner or trainee get to where they are trying to get. And I will use the term learner trainee. It may also be a junior faculty member or even a peer at times. But again, trying to keep my words as brief as possible, I will often default to learner or trainee, but you really could expand that to anyone that you're working with in these different capacities. All right. Oops. How about advisor? What comes to mind when you hear that term? Suggestions, advice, giving general advice. Achieving professional goals. I love that one. Passing exams or getting jobs based on experience again, often. Yeah. We'll definitely talk a little bit more about each of these as well. Helping the student get over a problem that he or she is going through. Absolutely. And then last, sponsor. What do you guys think of when you hear the term sponsor?
That there's some sort of investment going on.
Accountability, advocate, responsibility for someone, absolutely. Maybe helping them network, connections. A connector is another term I sometimes hear for sponsor. Outside the field, but offers financial or other type of support. It's true. Okay. All right, thank you for sharing, and we'll definitely get to explore these a bit more. And now I want you all to take just a moment and think about who are some famous mentor-mentee pairs that come to mind. And it can be, could be even a coach and a coachee, but I thought mentor-mentee might be more common for us in terms of thinking about them. Love it. Luke Skywalker and Yoda, absolutely. Father son, that's a good one. Hopefully you can each think of something that maybe worked well, maybe hasn't worked quite as well, whether again, that's in a book, in a play, personally, as some of you may be sharing here. Just a few examples I had thought of would be, so most of us know who Harry Potter and Dumbledore are. And then the ever popular Ted Lasso show, and he and his sort of coaching crew and a group that have formed around him, as well as Elton John and his many duets coming out recently. Some people may think of him really wearing all of those hats. Maybe he's sponsoring the next generation of musicians. Maybe he's mentoring or coaching them. William Waring and Louis Nasri. Great. I love the personal connections here. So definitely some different options. Oops, sorry about that. Too many windows open. All right. So many of you mentioned some of these keywords, but when someone approaches you, and this may be that you were being asked by a boss, a member of the medical school or residency program, or maybe a learner is coming to you and asking you to take on one of these roles, And often when someone says to you, will you be my mentor? They're really thinking of sort of a longitudinal relationship where you're going to be discussing multiple dimensions. It might be career, it might be research, it might be academic, it might be work-life balance or integration, depending on what term you like. And it's often at least, it will last the time, that frame that they are there. Maybe it's 4 years of medical school or 3 years of residency or fellowship, or longer, depending on your specialty. But it's also sometimes something that will extend throughout their career or your career because you started with them early on. And then there's the coach who, as you guys mentioned, is really focusing on a specific or specific skill or performance related issue. And it tends to be a shorter time frame, although sometimes you can get into that. Some of us are exploring coaching as a potential career opportunity. Some of us are actually coaches out in the executive world or academic world. And then a sponsor is using their influence in the field to make the individual more visible. And some of you mentioned it might be monetary sponsorship. It may be encouraging them to apply for a committee or nominating them for an award or asking them to attend a conference to expand their network and learn more about a specific topic. And then there's the advisor who is focused on a specific task often rather than sort of the overall growth of the learner as the mentor may be focused. The advisor, again, may be a longitudinal relationship or maybe a shorter experience. I often think of someone who is helping a student applying for residency or a resident applying for fellowship, but you were sort of advising them during that specific period of their career and their lifetime and helping them make decisions. So you may be advising at that point. All right, let's explore mentorship a little bit. And the word mentor was really derived from Homer's Odyssey, in which Odysseus gives or asks his friend Mentor to be a guide for his son Telemachus, right, as he is on his travels. And I think the key word there being sort of providing guidance or the guide for his son. In today's definition, we really think of this wise or trusted expert or experienced person who's interested in the development of the mentee. As we talked about earlier, it may be an assignment, or it may happen organically. This may be someone that you meet at a conference or work with in a clinical setting and just kind of bond with over something, and this evolves naturally, versus the one that brand new intern, you are a mentor for the residency program and you're assigned 4 mentees each year. Again, it tends to be a longitudinal relationship, but I think the relationship is often really spent in time where you are both probing with questions and listening to the answers, but also sharing your own experiences. As many of you stated, you really are the expert here, and you might be telling them what you did or what you would think about doing, rather than really questioning them on what they think they should be doing. The goals of mentoring are many, but a few here are really fostering the general support for your trainees at all stages so that they can thrive within a career in academic medicine, in community medicine, research, and to stimulate really a successful agenda. What are the goals for the end of their time with you, or at least the assigned time with you? And is it going to result in some sort of concrete evidence of success? Do they achieve the goals they had set out for or that you set for them? You're going to help them identify opportunities. Maybe they're going to explore career options, try a new type of research, or go out in the community and do some volunteer work and advocacy. And are you facilitating productive networking and collaborative partnerships, both inside and outside of that home institution? And certainly participating in meetings like this where we get to know each other over time, going to conferences, just meeting people in the airport. Sometimes you make connections that can be helpful for your learners. And then ensuring that work-life integration is addressed, allowing for both satisfying career growth and time to focus on their own personal lives. Sometimes you as the mentor learn things yourself, and by helping others, this can also help you, you grow in some of these areas. You may also have heard of the 4 C's, and then it became the 5 C's. And now I think many people are even saying the 6 C's of good mentors, rather. And with the first really being focused on career development, right? This is why most of us are starting the mentoring relationship. You can be a champion and sponsor. You can put on that coach hat. You're a confidant, someone they come to when they are upset or have gotten disappointing news. You may be a counselor and a collaborator. I would say many of us enjoy mentorship because we also benefit from scholarship or other academic productivity that we can collaborate with both our mentees as well as sort of their expanding network. And when you think about the mentee, the benefits to them include enhancing their self-efficacy and productivity. You're improving success of women and those underrepresented in medicine. Mentorship helps predict career success. If you ask those who are, say, young 40-somethings who are becoming division chiefs or really getting these amazing grant awards and things like that, and you ask them, and they will often say, I had great mentorship. I learned these skills. I've been able to put this team together. And then also the benefits to them include leading to less overall work-family conflict as they hopefully are learning and exploring their own values and what's important to them. All right, I said I was going to make this interactive, so I'm going to have Gary help me put you guys into some small groups here in just a moment. And I will provide you with a vignette. And I want you to think about behaviors of both the mentor and the mentee that contribute to building an effective relationship and that detract from their building an effective relationship. So we'll give you about 5 minutes in the group to discuss, and then we'll come back together. So your vignette here is, so Dumbledore has been asked to mentor Harry, who is very interested in a career in wizardry. It takes about 2 months and many emails to find a time to meet, and Harry arrives 15 minutes late. Out of breath, he apologizes and says he just finished his potions class and he forgot his requested CV. While they have met briefly in passing, this is the first time that Dumbledore and Harry have had a chance to meet, and Dumbledore introduces himself and details his professional background and experience. He explains that he's there to help Harry achieve both academic success and work-life integration. He asks Harry about his background, his move to Hogwarts, and about his experiences to date. Harry states he is glad he is attending Hogwarts, but has found the academic demands to be challenging, especially while training for the Quidditch team. Harry finishes his introduction by saying, "What should I know?" as he looks at his phone and responds to a text. Dumbledore shares some of his experiences as a wizardry student and asks Harry why he chose to come to Hogwarts. Harry says, "I want to be at a great institution that will support my career growth." He then says he has 15 more minutes before he needs to get to practice. He wants to know what he should do before he graduates. What he should do to make sure that he graduates. Dumbledore suggests they find another time soon to talk at length, but Harry states he is very busy and probably won't be able to find time for another few months and would really just like to hear the, quote, key points now. All right, so your assignment was to think about what is helping and detracting from the two of them building an effective relationship.
How long do you want the breakout room to go, Rebecca?
About 5 minutes.
Okay.
Thanks.
All right. So I'm going to open the rooms.
Right, so it looks like most people are back. We're almost back here. Anyone willing to unmute and just sort of share what you and your group talked about? Were you able to identify some characteristics that Harry and Dumbledore are showing us that maybe were helpful or not so helpful in their relationship building?
Hey, Campbell, Grant. One of the helpful things that they did is both sort of talked about their background a little bit, or they got into their background to kind of help establish, to give some sort of way to try and connect with each other.
Yeah. So just sort of knowing where each person's coming from, right, can be really helpful.
So I'll jump in. Can you guys hear me? Shannon and I, oh, wonderful. Shannon and I discussed three things that we thought were helpful. One is, gosh, I can't remember exactly how we said it, but patience. I think that's what we said, or I said patience. So obviously, it's very easy to be upset or disappointed in the mentee, but a mentor has the experience, hopefully, to be patient with somebody who's wants instant gratification or instant results. Then we talked about commitment related to the front comment just now. So commitment to the process. Again, that's a shared decision-making thing. And there was a third one that I can't remember, but.
Okay. Well, those are two excellent ones. I appreciate it. Thank you. Anyone else willing to share? Well, I think we can move on. And you guys actually mentioned a few that I may not have included as well. But I think sort of establishing role responsibilities and what you have expectations for your mentee and what their expectations may be of you is really helpful. And so there's a lot of literature on sort of setting your mentee up for success and having them do some things that are very helpful and maybe not do some things that aren't so helpful. And this list can be found on the UCSF Faculty Mentoring Program website, but really encourages your mentee to be the proactive one, to take initiative, to set up the appointments, to bring an agenda, to not sort of sit back and be passive in this relationship. Really respecting the mentor's time. And some of you already mentioned sort of that generational difference. And they want a lot, but may not always recognize that they are also asking a lot. In return, when they say, oh, I can't meet from 8 to 5, it has to be before 8 or after 6. And you're like, well, I have things to do too. And them not always sort of respecting that time. Encouraging them to practice self-reflection, right? Being vulnerable, thinking about the things they really want, that they value, is going to help them get much more out of the relationship and much more out of the meetings that you set up than someone who is disorganized, late, not willing to sort of do a little bit of that deeper reflection. Asking them to communicate the agenda, update the CV regularly, sort of the things that help with the organizational piece. Even if they send the agenda with 3 points to me the night before, that at least kind of helps me get into the mind frame of where they are, what they want to talk about. You know, I say it's great if I can get it a week before, but honestly, I probably look at it the 24 hours before. And so the day before, it's fine. Encouraging them to think about building a mentorship team. And we'll talk about that a bit more in a few minutes. But again, recognizing that one person can't meet all of the needs of a single learner. And then having the mentee be willing to do some teaching. I think I learn a lot from my mentees, whether it's updates on pop culture or some new genetic test and syndrome that has been identified, a favorite restaurant that's just opened in Philly, right? Like there's a lot that we can learn from them as well. And having them build on that relationship that many of you mentioned can be really helpful. I think encouraging the student to know that it's also okay to recognize when that sort of assigned relationship just isn't quite right. And that they can say thank you, but no thank you. I have identified someone else or have begun to build my team and I don't want to waste your time. And being able to have those honest conversations can be very helpful. There are other types of mentoring experiences. It's not always the one-on-one, and certainly peer mentorship has become more important over time. I think both at sort of an early learner level where students are supporting other students. Many medical schools and residency programs have essentially developed a house type of system, whether they call it houses or groups or whatever their name may be, but where sort of more senior students may be mentoring more junior students. And I think even as faculty, as we rise through the ranks and become the middle and older faculty and our own mentors begin to retire, leave academic medicine, et cetera, we actually begin to do more peer mentoring with each other when we realize that our other mentors just aren't necessarily there or available any longer. And then that idea of the mentoring team, and I borrowed this image from the National Center for Faculty Development and Diversity here, but you know, encouraging them again to think about who and what they need. Do they need someone different for professional development? Do they want role models to become mentors? Someone who may be sponsoring them or providing emotional support and access to opportunities, sort of everything research, academics, clinical time, et cetera, that they may be looking for. And what about you as the mentor? What are you getting out of this? You know, most of us go into medicine because we want to help people. We enjoy educating. We, you know, want to help make people feel better. And in many ways, we get a lot of satisfaction for helping others through this mentoring process. Again, we get information and feedback from our mentees. And then it can also certainly help in their recognition, whether that's through promotions, maybe your school offers awards for top mentors, and just building a reputation as a strong, responsible, committed mentor who has patience, as one of you mentioned. And then I do think when we think about burnout and wellness and sort of our own career satisfaction, being a mentor can be really powerful and empowering and help us stay excited about the things that we are doing. Want to shift now to talking about an advisor and thinking about who this person is and what role they may play. And thinking of an advisor really as someone who has subject matter expertise and whose primary role is to provide, again, guidance or advice to another person or sometimes a group of people. It is often sort of an issue-focused relationship and will depend on what the learner needs or is seeking. Maybe this is an advisor about a research project. I will say Gary has been both an advisor and a mentor around qualitative research. When I first started in ComSep and learning about educational research, I knew nothing. And here was this kind of expert who was able to both mentor and advise us through the process. It is, again, sometimes an assigned role, and it may be much more time limited in that it's a shorter time period that you're spending with people. I would say you're telling and answering much more in this relationship than you are probing and listening. So you're really talking about a process or how to gain a skill. And falling back on the idea of residency advising, you know the sort of timeline, you know what the expectations are, and you've probably done this a few times, whereas the student is going through this for the very first time. So you really are sort of the content expert who is available to help them. All right, we are going to do another small group breakout. I told you this was going to be interactive. And again, I want you to think of behaviors, both on the part of the advisor and the advisee, that are contributing to and detracting from effective relationship building. So Gary, if you don't mind, in just a moment, again, working your magic. So your small group vignette. So now Dumbledore has been asked to be an advisor for Ron Weasley, who is interested in applying for a residency in wizarding leadership. He is planning to meet today with Ron to discuss his application and help him think about beaches and safeties. From Ron's transcript, Dumbledore can see that Ron is in the middle of his class for his grades, that he failed his potion subject exam once, but passed it on his second attempt, and that his magical performance exams are solid, but not exemplary. Dumbledore has heard that Ron is most interested in staying at Hogwarts, which has one of the most competitive residency programs for wizarding leadership. Ron is excited but nervous to meet with Dumbledore about residency applications. He's hoping to stay at Hogwarts and believes he has a chance as he is, quote, above average. He's hoping to find out from Dumbledore how to make his application as strong as possible so he stands out to the selection committee and gets to stay at Hogwarts. All right, so again, thinking about those behaviors that both contribute to and detract from building an effective relationship.
Thanks. There we go. Rooms are open.
Thank you. Looks like people are coming back to join us. All right, so is anyone willing to unmute and share a little bit about what you talked about in your small group, so related to advising? It could be about Ron and Dumbledore, or it could be about something that you may have experienced yourself.
Yeah, we were discussing in our group, a lot of times when students are kind of entering like the fourth year advising process, they tend to either overestimate or underestimate, but seldom, if ever, correctly estimate their abilities. So I think that's where an advisor / mentor can really help with the process. So.
Absolutely. Sometimes they just don't quite have the insight yet that they need. Sometimes they won't develop it, but sometimes they will. Anyone else?
We also talked about having a standardized approach to something like advising someone for applying for residency. That really helps. Absolutely.
I almost have like a checklist, and sometimes I will pull it up and kind of be, all right, what do I need to do in meeting 1 and meeting 2? That's a very good point. Anyone else? All right, well, we can move on to talking a little bit more about the advisor's role. I think, first and foremost, our job is to be an advocate for our student or learner. I think being honest and saying, you're really kind of just above average, the top program may not be quite for you. It's a reach, you could still apply, but like, let's also have a strong sort of safety or realistic group. Certainly creating a safe space where the student feels like their feelings and words are going to be held confidentially so that they can share their thoughts and such. And then this relates specifically to sort of residency or potentially fellowship advising, but thinking about those reach and safety programs, helping them identify strong letters or strong writers of letters. And then are there additional experiences that they may be able to do or should do to sort of enhance that application? Offering to review personal statements. Not every student takes me up on that, but they always appreciate the offer. And I think it sort of helps them to know, even if they don't share it with me, that there is someone willing to take another look at it. And then thinking about sort of your checklist, but also just being aware of timelines. Again, it really is the advisee's responsibility to know what those timelines are and the deadlines for submitting things, but it's helpful for you to have that as well, and potentially block your calendar during match week if you think your students are at risk of not matching and may need to help with the SOAP process or anything like that. Your advisee ideally is coming prepared. I have a few students show up with a whole list of questions, whether it's on their phone or on a piece of paper, and at least a draft of their initial documents, their CV, their personal statement, et cetera, can be very helpful. And again, even asking for it 24 hours before that meeting, if possible. Making sure, again, the advisee knows about their deadlines and that they are, again, willing to self-reflect and be honest about what their wants are, what their maybe nervous about, what is important to them as they are going through this process. And then our really final topic, we will just very briefly touch on sponsorship, but the coach is one who is working with a coachee to evaluate performance and assist your coachee to identify needs and create a plan to achieve specific performance improvements. Again, as we mentioned earlier, does not necessarily have to be an expert or even a more experienced person, but really someone who's good at asking the important questions and listening to the answers to help the coachee develop a plan. This may be a short or long-term relationship, depending on what the goal is. And most of your time as a coach is really going to be spent probing and listening. You are asking those questions and listening to the answers and asking follow-up questions based on those answers. A lot less time is really spent telling and answering, sharing your own experiences. The number one rule is you are there to listen, right? You are asking questions. And I actually think it's almost the reverse of a history of present illness, and that you're actually starting with very specific questions that will get them starting to think and talk. And then you lead to more open-ended questions, and then maybe get more specific again. Again, may depend on the relationship and how well you know the person you're working with initially. Again, reassuring them of this safe and trusting environment where they can be vulnerable with you and share their thoughts and feelings. And your job as a coach is really to guide the coachee in making those important decisions and recognizing the need for behavioral changes, and then helping them to develop an action plan. So I think many medical schools are moving towards sort of clinical coaches who may be working with students who may not have the best communication skills in team settings or with patients, or who may have some clinical reasoning issues, and really helping the students concentrate in those areas. Our residency program has started a coaching program in this past year where we have faculty working with residents who want to focus mostly on specific clinical skills as well. But again, as a coach, you really want to think about what is it that my coachee is trying to get out of this experience, and is the goal sort of reasonable? I like to fall back on that SMART acronym of, is it something that's specific and actually achievable in the amount of time that we have, or that they think that they can do it in? Is it attainable and realistic? And again, is it timely? Whereas your coachee, again, should have a specific skill in mind when they are reaching out to set up these discussions with you, and should set the agenda with a timeline for when they want to achieve these goals and sort of their expectations around how this is going to happen. And again, that willingness to be self-reflective, maybe going out and gathering information from others, whether it's a survey or just some questions that they may ask. And they have to be willing to listen to those answers. They may not always agree with the answers, but sort of trying to understand other people's perspectives can be very helpful. All right, and your final breakout group. So we're going to give you a vignette, and I want you to think about which hat you're going to wear in this scenario. Do you want to be a mentor, a coach, an advisor, or maybe all three or two of the three? What expectations do you want to set in your first meeting? And what is most important in helping the student in this scenario? All right, so you are an associate clerkship director and are approached by a student who has received midpoint feedback that has upset them. The student was told they have a poor knowledge base, a need to improve their efficiency, and that their presentations are, quote, all over the place. The student seems quite upset. All right, so again, which role are you going to assume here? The mentor, the coach, or the advisor? What are the expectations for that first meeting? And what is most important in helping this student? So Gary, if you don't mind, 5 more minutes in a small group, and then we'll get back together. Right, so Gary tricked us to keep us on time here and cut us a little short, but I think that's okay.
There's still 3 rooms that are staying on.
Now, see, they had a lot to talk about this time.
They'll be done in 12 seconds, so whether they like it or not.
I think folks are coming back now.
Yep.
All right. So hopefully you all were able to have a few minutes to chat about this one and explore a little bit about which hat or which hats you would wear, and just hoping one or two of you would be willing to share what was discussed and sort of your response to this vignette.
In our break room, we spoke about, I said that I wanted to be the mentee, and I think they agreed with me. I think we would want to see what the insight of the student is at that time. You know, is it complete denial? Is there some insight? And then the second thing is that, and I'm sure everybody has heard this, but everybody thinks I'm wonderful. Everybody else thinks I'm wonderful. It must be this professor. And so it could go both ways, right? It could be like the professor is really incorrect, or, you know, the rest of the professors are just rushing through the evaluation and not putting things how they need to. And this is hurting the students and their insight into their own problems, right?
No, absolutely. Yeah, I think that really knowing what the student's insight here is very important. And until you can kind of get to that, it may be hard to know exactly which role you're going to be playing or how they best, what response they need.
Right.
Anyone else? Pick a different hat or a different role?
I agree. I think in our group, we discussed the coach, you know, using that 75%, listening first to see how they're regulating the emotion. We know students, right? Any negative feedback with a lot of type A personalities, they're going to take that very personal. So it's really seeing how they interpret the feedback. Is it, you know, a lack of insight, or maybe they agree with it, and we can already know where we need to go. So is this going to be something that we need to have follow-up meetings or what? But kind of just the first meeting would just be, you know, what they thought about the feedback, and from there I think pivot to where we need to go. But a lot of it is, you know, maybe emotional handling, or if they're already kind of at the acceptance and they're like, okay, well, what can I do to improve this? Then we can kind of switch more into the advisor perspective and, you know, let them know what we think is the best way to handle that particular situation.
And you guys bring up a great point about sometimes that first meeting, you're not going to get beyond the emotion, right? You just need to let them vent and process, give them some time to sort of reflect and think about it, and then come back and meet again to be able to move on, really depending on how upset they are, right? Like, as you said, many of you have said, we're type A, we're perfectionists. To hear that we didn't do something well can be earth-shattering, and sort of being able to have time for that can be longer than we think sometimes. But I agree. And it seems that at least the two groups who have spoken up, like, you really want probably at least two of the hats, maybe mentor coach, maybe coach advisor. Like, there's a little bit of, again, overlap and really sort of a spectrum here. I think in some ways the sponsors kind of over here on their, not quite own, but in a little bit of a different area where they have a discrete expectation or thing to contribute. And then you have this mentor coach and advisor who's kind of a spectrum. And again, at different points, even in the same meeting, you may be all three of those roles. I know we have just a couple minutes left, but just wanted to see if anyone has a specific example or a question that they wanted to share with the group. Anything that's happened to you recently in any of these roles? I'm really good at silence. Even virtually, I can sit in silence. All right, well, I am definitely happy to hang out for a few minutes and see if anyone has specific questions, but just reminding you all that, you know, our jobs are sometimes really hard, but we all want to help others develop and grow, and we ourselves want to continue to develop and grow. And I think a lot of what we've talked about are things that you're already doing. These are skills that you already have and can just kind of maybe think a little bit about at certain points of like, who am I trying to be right now? And therefore, how much listening or questioning versus telling should I be doing? And so working to develop and improve your own skills is going to make you a better leader and educator, and the students and learners that you work with will appreciate you even more. I appreciate you all joining us today, and I'll definitely hang out for any questions. And then just a few references for anyone who's interested.
Thank you. This was great.
Thank you. I'm glad you could come.
Sure.